Hello friend, today we will understand how accurate is COVID-19 testing which is performed currently with the RT-PCR based method. So is there any false negativity or false positivity? So just let us understand this. Okay, so the reason for the false negative cases in RT-PCR based method for COVID-19 are one of the most important reason. The first reason is the improper specimen collection, and because due to the invasive nature of the specimen there is a chances that the expert who is collecting the specimen may collect the improper specimen, because it's an invasive procedure or a nasopharyngeal swab and difficult for the patients, and it's a very uncomfortable for the patient as well. And there is a chances there's a improper transportation of the specimen and improper handling. And second reason for the false negative results for COVID-19 test is the inadequate number of organism present in a specimen. So what we call it as a basically there is a lower fragment of RNA fragment in a current specimen, where the detection limit of the RT-PCR based test is basically 51 copies per ml, and where the detection limit is 81% only. So sensitivity decreases when there is a lower number of organism or lower viral fragments are there in the specimens, and a sensitivity, or we can say detection of limit or detection rate, increases when the viral load, or we can say it's a viral fragments are more. Suppose if it is a 136 copies per ml, the detection limit increases, detection rate increases up to 95%, and if it is a 363 copies per ml is there, it's almost 100%, and more, and it's a 100% detection limit is there. So there is a chances that a collected clinical specimen may have a lower number of organism present in the specimen. The third reason is basically the time for specimen collection. So because there is as such time has specified for specimen collection, because there may be chances that it is collected too early at a time of infection, or is it too late at a time of too late in the course of COVID-19 infection. So there may be chances, because there is no specific guideline as of now available. And the fourth reason is the incubation of the COVID-19 virus, because COVID-19 virus incubation is not yet identified or not yet recorded, because it may be of a week, or it may be 2 weeks or 3 weeks, or in a month. So it is still not known, okay, how much is the incubation period for COVID-19. If incubation, because as per the flu-like viruses, there is an incubation period is almost 1 week, but for COVID-19 it seems to be a more incubation period, because in many patients which were earlier negative and comes positive after 2 to 3 weeks time. So there is a incubation is the another role which plays especially for COVID-19 false negativity. The fourth reason is if there is any mutation in the COVID-19 target gene segment, which we are amplifying with the RT-PCR method. So there may be chances that if there is a mutation, the result will come negative, and there is a false negative in this case. And the fifth and the last reason is that we call it as there is a PCR inhibitors, or there is a inhibitors amplification inhibitors, which are unknown cause inhibitors may be present in the specimen, which hinders the RT-PCR, or we can say the amplification process. So the another part is the how much is the positive or negative predictive values of this test. So positive predictive values and negative predictive values are highly dependent on the prevalence of the disease. So it is a dependent factor on the prevalence of the disease. If there is a high prevalence of the disease, there is a chances that the result may come the most of the times, more likely it may come as a false negative if there is a high prevalence is there, and more likely if the false positivity will come only when there is a moderate and low prevalence of the disease is there. So it is a depending factor on the prevalence of the disease. So this is just a smaller update for COVID-19, how accurate is this test, and false positivity and false negativity.